Welcome to Fit and Bold, where we promote healthy lifestyles. I'm your host, Lakita Goins. Many of us have heard of aneurysms. Although people can die from them, there are people who live with them every day. So this topic is worth taking a closer look at so that we can better understand what an aneurysm is and how they can be successfully treated. So I have with me here today Dr. Mark Hartsfield from the UAMS AHEC South Central. How are you today?
I'm good.
Okay, so I'm going to dive right in. Tell us what an aneurysm is and where they can be located.
Okay, basically an aneurysm, there's two types of vessels in the human body. There's arteries and there's veins. Basically an aneurysm involves the arteries. Arteries are deal with high pressure compared to a vein. This makes them more susceptible to an aneurysm. What an aneurysm is a weakness in an artery that causes like a balloon-like bulge into the artery itself.
Okay. So, is an aneurysm life-threatening?
It depends on where it is. They're most commonly located on a vessel called the aorta. This is a vessel that comes out of the heart and goes down the middle of the body. And aneurysms can be theoretically located anywhere there's an artery. So sometimes they can be located in the brain. And obviously, if they rupture inside the brain, they can cause strokes and bleeding on the brain, and that can be life-threatening. But again, it's very dependent on the location of the aneurysm, but if it's in a severe place and there's lots of blood loss from the ruptured aneurysm, it causes problems, but not all ruptured aneurysms lead to death. So.
Okay. So does genetics play a role in who has aneurysm?
It can. There are certain conditions that predispose people to form aneurysms easier than others.
Okay.
These are conditions like Marfan syndrome or Ehlers-Danlos syndrome. These are both what they're called connective tissue diseases, but these are again are genetic diseases that you get from your mom and your dad. So.
Okay. Are women affected more than men, or do they have any?
I did some reading before I came, and there seems to be some conflicting data on that.
Okay.
Some people say men more than women, some say women more than men. So I think there is no real good answer for that. So.
Okay. What are the symptoms of an aneurysm, or are there any symptoms?
That's again dependent on where the aneurysm is located. If it's located in the brain, in the arteries in the brain, if it swells up, like I said, like a balloon-like outpouching, if it becomes bigger or starts to press on things, it can cause symptoms such as nausea, vomiting, extreme headaches, things like that. If it's located other places in the chest where that aorta is or in the abdomen, again, if it presses on things, it can cause pain or discomfort or non-specific complaints sometimes.
So is it ever mistaken for any other?
Usually when aneurysms are discovered incidentally, when people come in for different complaints, maybe they go to the emergency room with something else and they get a imaging study like a CT scan or an X-ray, and they're found almost this wasn't the first problem, but now you find it on incidentally, and now it becomes an issue.
And so you just touched on, I was going to ask how doctors find aneurysms.
Yeah, and again, it's if it's suspected, if someone has a family history of an aneurysm, or someone in the family had an aneurysm, or they're concerned about it, or they have some risk factors for having an aneurysm, usually the diagnostic study would be an ultrasound, which is a sound probe. You can place it on where you suspect the aneurysm be. This is obviously limited to maybe someone suspecting like an abdominal aortic aneurysm.
Okay.
There's different studies depending on where they are, but that's usually the screening tool we use.
Okay. Can people live with the aneurysm? And you already said you can, but what is the quality of life?
Aneurysms, when they're discovered, they're basically, we like to know how big they are, so we would try to size them the best we can. Small aneurysms can be, there's no impact on quality of life. It's just something that the way you prevent these things from growing is you keep someone's blood pressure in the normal range. Because ideally, if you keep the blood pressure low, it never gets high and puts increased pressure on that weak area and can make them grow. So if someone keeps their blood pressure under control and has an aneurysm, as long as, again, it's in a location that's not susceptible to high blood flow or weakness for whatever reason, then they can live no impact on their life.
Okay. What are other treatment options?
If an Now, if an aneurysm ruptures, again, it depends on where it is, what we do for it. But someone comes in to, say, an emergency room and they're with severe headache and it was an aneurysm in their brain that ruptured, because this is the aneurysm. I think that when people hear the term aneurysm, they think brain aneurysm.
Right.
Usually what can happen there is a couple different things. One is this is advanced surgery, so I'll do my best. But
okay.
These people go in. They can go into the brain through a vessel in your leg. They go in with a catheter and they'll float all the way up, and they can go into that area that's weak, and they can use some kind of coil and repair the aneurysm.
I read about that.
Yeah, and also there's another type of surgery where they basically form a blood clot, basically, and they block the aneurysm off. So.
Oh, okay.
But that's what they do in the brain. If it happens in the like a thoracic, in the chest, right around the heart, again, there's ways that some surgeons can go in and block blood flow to that vessel and repair it somehow by putting stents in and keeping it open. And it's just it's a very severe situation, but that's if it ruptures. But.
So now I have another question. If you have some of these symptoms that you talked about earlier, is it short term, is it long term? Like, do you notice pain for a long time, or how do you know when you should go to the doctor?
Usually, like I said, usually there's guidelines that doctors use to screen people for certain disorders. Right now the recommendation for screening for, and this is primarily an abdominal aortic aneurysm, which is more than likely the most common aneurysm, and that's they really recommend it for males, not females. Again, I'm not really sure why, but it's age 65 to 75, and the primary risk factor for developing aneurysms is cigarette smoking. So if someone's been a smoker or has a significant family history and they're age 65 to 75, it's recommended that they can have a screening ultrasound on their big blood vessel in their abdomen.
Okay. So that being said, I want you to talk to the audience now. Give them your advice on smoking, going to the doctor, preventative care, just some general advice.
I think with any doctor would recommend against smoking. Smoking not only increases your risk of developing aneurysms, it affects your heart, lungs. It's really one of the most detrimental things you can do to your body. So if you're smoking and you want to stop, there's a million different ways you can stop. There's medications, there's treatment programs. If you don't think you can do it on your own, go to your doctor. Your doctor can help you with that. And as far as if you're worried about an aneurysm, or say someone you know had an aneurysm, or you may be concerned about that, again, you can ask your doctor about it. But if you're young and less than 65 years old and not a smoker, even with the family history, usually there's going to recommend against doing any kind of imaging just to look for an aneurysm. Because again, most aneurysms are found incidentally on other tests. So. Well,
thank you for coming on the show today and taking the time to talk with us. So when we return, we're going to be doing our Fit and Bold Healthy Recipe Pick. Stay tuned.
Listen to me. I am captain of the track team. And if I'm late,
she doesn't really think she's going to get out of here, does she?
Be nice. She's new.
Hello, is anyone there? Ugh!
Wow. Even from our standards, you look awful.
Oh, sweetie, what happened?
Me? My friend Becky got to talk to this super cute boy, and I tried to act like I wasn't jealous, but I so totally was. And then out of nowhere, this concrete barrier just popped up. Maybe it was a semi.
You mean you were driving?
Yeah. I mean, I know the whole eyes on the road thing, but this was a super important text. Maybe you have to know, Becky.
Texting? Great.
But it was only like 5 seconds, and I'm a really, really fast texter, so it wasn't even a big deal. Actually, has she texted me back yet? Wow, I get like no bars in this place. I wonder if they have Wi-Fi here.
Hi, I'm Sunflower Wilson, a recent graduate with a degree in fisheries biology. As I begin working on my master's, I am confident in the skills and lessons that UAPB has taught me through instructors like Dr. Hawkness.
Sunflower challenged herself with a rigorous course curriculum. Her efforts led to numerous presentations in front of scientific audiences, at state and national venues. A National Science Foundation internship gave her the opportunity to go to Alaska and work with scientists examining crustacean physiology. UAPB prepares its students for opportunities like these every day.
UAPB prepared me.
Checking your fantasy league?
Nah, just my 401k statement.
Nice. Where'd you find the money for that?
I just been saving a little every month.
I can't seem to save anything.
Well, what about all this? What about the money you're spending?
What money? It's gone before I can get my hands on it.
I got a pizza for a Todd.
Hey, can somebody spot me?
When it comes to financial stability, don't get left behind.
It's 547.
Get tools and tips for saving at feedthepig.org.
Welcome back to Fit and Bold. Now it's time for our Fit and Bold healthy recipe pick. So today we're going to make spinach chips. So this can actually work for a variety of vegetables. I actually saw the original recipe for collard greens. So I had never thought about collard green chips, but it's very simple. It only takes about 2 to 3 minutes to make. So the first ingredient you're going to need is, I'm using spinach. So I have spinach, I have pre-washed it, and I just have it in a bowl, and you can kind of see it's fresh green leaves. Now spinach is always good for you because any vegetable or fruit that have bright colors are always going to be heart healthy, and spinach has iron in it and other nutrients that are key. So the next thing you're going to need is olive oil, and I normally don't say brands, but I found this seasoning that I think is great. It's called Mrs. Dash, and I like it because it's a salt-free seasoning. So the first thing you want to do is you want to take your olive oil, and you're just gonna put, I don't have exact measurements, but I'm just gonna put enough to fill up this spoon, and I'm just gonna kind of sprinkle it around. Then I'm gonna take my bowl and I'm just gonna mix it, and you can kind of tell once your leaves are coated, then that's gonna be good. So now I can kind of see that my leaves are coated. You can kind of see that on there. Now, the next thing I'm gonna do is take the Mrs. Dash. Now, first I'm gonna tell you, you wonder how can a seasoning be a seasoning without having salt in it? Well, this has onions, it has black pepper, celery seed, basil, it has mustard, rosemary, orange peel, tomatoes, carrots, citric acid, and other lemon juices. So as you can see, what I'm gonna do is put some on the spoon. And if we can see those bright colors in that seasoning, I'm gonna go ahead and just sprinkle it. And I'm just gonna mix that around. Now this is just gonna give your chips some flavor, because even if you were eating regular potato chips, you probably wouldn't want it with no flavor on it. That's what makes them so good and unhealthy, is that they have a lot of salt. But we're gonna be healthy here. Your next step is simply, if you wanna have a no mess cleanup, I just take a small piece of aluminum foil and I just put this right on there. There's no need to spray it because you have the olive oil on the leaves, it won't stick. But you're gonna put this in the oven at 350 degrees and bake it for about 12 to 15 minutes. Now, it depends on how crispy you want it. So what I'm gonna do now is show you kind of what it looks like. Now, I cooked the night before, but you get these crispy leaves and you can kind of tell they're dark, they're done. And I'm just gonna take a taste of it. And that's great. It's crispy, it's flavored, and it's healthy for you. And it took less than 2 or 3 minutes to make it. So maybe consider doing vegetable chips instead of regular chips, because it's nice to want that crunch sometimes, but let's try to find healthy ways to do it. Now, when we return, we're gonna be doing our Fit and Bold healthy exercise segment. So get your workout gear on and stay tuned.
How did UAPB prepare me? The Business Marketing Program. Here at the University of Arkansas at Pine Bluff, the faculty works very close with us, making sure we reach our full potential. With the help of Career Services, I was able to obtain an internship with Hope Federal Credit Union. This opportunity allowed me to travel to different states and learn additional skills. The company was so impressed at how talented and prepared I was as an intern that they offered me a full-time position as program officer. That's how UAPB prepared me.
I have a future to live for.
I have a life I love.
I have people who would weep for me.
If I went to heaven above,
when you're out there, there's no telling what you'll find.
I see it! I see it! Oh, look at you.
There are some moments only the forest can inspire. Find yours at discovertheforest.org.
Welcome back to Fit and Bold. It's time for our healthy exercise segment. I have Tori Gordon here with me today. She is a yoga expert. That's what I'm going to call her today. How are you?
I'm great, thank you.
All right. Tell us about yoga, why it's important. Let's talk about exercise.
Okay. Well, you know, yoga is important just like any other type of activity where you're moving your body. It just keeps you limber. It can reduce stress. And, you know, even what makes yoga unique from maybe other exercises is that there is sort of a meditative or spiritual element to it. So for a lot of people, by practicing the physical postures of yoga, they get a calmer sense in their mind, and it's a way for them to connect with something bigger than themselves.
Okay.
So that's awesome.
It sounds great. So audience, let's get ready to exercise. All right, audience, let's exercise.
Okay, hi. Once again, we can step onto our mat. Basically what I'm going to show you today is a sun salutation, which is how most yoga practices begin. They're designed to just basically warm your body up. So in a sun salutation, you're going to get postures that stretch your hamstrings, stretch your shoulders out. I'm going to add some stuff in there just to give you some more ideas. If you can't ever make it to a class, maybe some of this you can take away and try to do it on your own when you have the time. Okay? So for the beginning of a sun salutation, we come to our mat. We start off in mountain pose, either our big toes touch or maybe there's about 2 inches in between. First move is to take a big inhale, sweep our arms all the way up towards the ceiling. And then exhale, we fold forward into our forward fold. So here, great stretch for the backs of your legs. As we inhale, we lengthen our spine, come to what we call a halfway lift. So here the crown of your head is pointing towards the front of your mat. You want a straight line between the crown of your head and your tailbone. Hands can rest on your shins or even higher. Depends on how flexible you are. So we take an inhale here, and then we exhale, forward fold. Inhale, sweep the arms all the way up towards the ceiling, and then maybe take a slight back bend. Allow your hips to sway forward. Okay? So it's not gymnastics. You don't have to go all the way back. It's more about just creating that length along the front of your body. Okay? Take a deep inhale, and then exhale, we're going to come into a pose called chair. Okay? So in chair, you want to keep the weight of your body in your heels. one thing to think about is if you can look down, you want to be able to see all 10 of your toes. If you can't see all 10 of your toes, that means you need to sit a little bit further back. If having your arms up this high is uncomfortable, lower your arms so that they're shoulder height. Try to stay in the chair for about 3 breaths. You're probably already feeling it in your quads. This is a really great posture for your glutes as well. And then from here, we fold forward, once again to our forward fold. Inhale, halfway lift, flat back. Exhale, forward fold. Good. We're gonna plant our hands, step our right foot back. Come into a runner's lunge. So in the runner's lunge, your front knee is over your front ankle. The back leg is straight and that right heel is lifted up. Good. So this is great for your hips, groin, quads, gonna stretch it all out. From here, step back. Bring your left foot to meet your right so that you're in plank pose. So plank is like the top of a push-up. What you wanna watch out for is a saggy pelvis, all right? And you also wanna avoid having the hips too high. You want the hips to be right in line with the shoulders. So try to stay here for 2 to 3 breaths. Then lower your knees down to the mat. We're gonna do a chaturanga, also affectionately known as a yogi push-up. What you do, knees are on the mat, take a deep inhale, and then exhale, lower your body down until your arms come to about 90-degree angles. From here, inhale into upward facing dog. So your thighs and knees are lifted off the mat, shoulders are pressing down. Good. Then lower your knees down to the mat, sit your hips back to rest on your heels, and come into child's pose, which is a resting posture, and it's just an overall great posture. It's really good for your lower back, and it's nice and relaxing. In child's pose, your forehead rests on the mat, arms are nice and straight, fingertips spread far apart, and you can stay here for as many breaths as you need. Okay. Then you can inhale, come back up to our tabletop pose. Curl your toes, bring the balls of your feet to the mat. Exhale, lift your hips high to downward facing dog. A great stretch for the backs of your legs, calves especially. In down dog, you want your gaze, ooh, I almost slipped. You want your gaze to be at your navel or in between your upper thighs. Okay, elbows are straight. And then inhale, rise to your toes, look to the top of your mat, and exhale, baby step your feet up to meet your hands. Come back to the forward fold. Inhale, halfway lift, lengthen the spine. Good. Exhale, forward fold. Inhale, sweep the arms all the way up towards the ceiling. So we're always putting breath with the movement. Then exhale, bring the palms of the hands together. Lower them down to your heart center. And there you go. Yeah. Good job, you did great.
That was a great workout, and it was harder than it looked. So we're gonna go to some students to talk about what being healthy means to them. And I have a student with me here today. She's running for Miss UAPB, and I met her in the press shop. So tell us your name and your classification and major.
Okay, my name is Ayla Bell. I'm from Arlington, Texas. I'm currently a junior majoring in biology at the university.
Okay, tell us what being healthy means to you.
Healthy to me means not necessarily your size, but just that you're eating right and getting the proper exercise that you need for your age and where you're at in life.
Okay, that makes sense. So would you be interested in doing a free class of line dancing, Zumba, water aerobics, regular aerobics, or lap swimming?
I would be very interested in water aerobics. I've actually been enrolled in the class before and I enjoyed it thoroughly.
Okay, and would you have any advice for your fellow students as far as being healthy?
As far as being healthy, most of it is eating right, but also find something, a way that you can exercise and really enjoy it, and that way you'll be able to stick with it.
Thank you so much for taking the time to do the interview.
Thank you all.
All right, and I have a student here with me today. Give us your name, classification, major.
Really Damon Ware. My major is psychology.
Okay, and what's your classification?
I'm a junior.
You're a junior. Now, what does it mean to you to be healthy?
To be physical fit, able to perform that other people can't perform.
Okay. So, and you mentioned something about eating healthy. It's okay. We're trying to be honest here, and some of us don't eat healthy all the time, including me. So tell us about how you eat. You're a student. I see you're an Omega. What do you do what are you eating?
We like to eat chicken.
Is that baked, fried?
Barbecued.
Barbecued, okay. So would you be interested? We have on campus, we have water aerobics, line dancing, Zumba, regular aerobics, and lap swimming. And we're offering some of these classes free to the students. First 10 to sign up. Would you be interested in doing one of these classes? And if not, what would you like to see as an exercise class?
I like to swim, so I think I'll do the swimming class.
Okay. Well, thank you so much for taking the time to do the interview, okay?
Thank you.
All right. Thanks to the students of UAPB for taking the time to do the interviews about being healthy. Thank you to Tori Gordon, who showed us some wonderful yoga poses. And she has classes on Tuesdays at 6 o'clock at Natural Bliss and on Thursdays at 6 p.m. at the Waterfront Building. Her contact information is listed below. Also remember, UAPB Black and Gold Fit and Bold has many fitness classes open to the community. Just call Cynthia Anderson at 575-8000. Remember, getting healthy is a journey. The best thing to do is get fit and be bold.